Hello and welcome to QuAF 400 Screencasts. In this episode, we'll be discussing cardiovascular disease primary prevention template. Using our by now familiar test patient, we are going to go ahead and launch the CVD primary prevention template, assuming that this patient does not have an underlying cardiovascular illness. Here we can see our familiar template form, and to simplify matters, we have added a reminder of the NHS health checks and their criteria. Assuming that this person does not have any particularly significant cardiovascular history and that he or she suffers with essential hypertension, we're going to go ahead and choose that here. And as a result, we then have to add the CVD risk assessment code. For example, we can either use the Q risk or the CVD risk assessment. Let's say go ahead and use the CVD risk, in which case you now also have the appropriate calculator available to your use. If you click on that, then you'll be presented with this particular calculator with the data already established in there, and then you can go ahead and save that to your patient's record, and you are then done with this particular template. Of course, as you can see here, we have the new recall button. You decided to review your patient over the next 6 to 12 months, for example. You can go ahead and choose the appropriate risk review, say in 12 months. It doesn't have to be that particular interval. You can always choose your own interval based on the appropriateness for that particular clinical situation. Once you are done with this template, then you can go ahead and say, I am done with this, and then go ahead and you are done. Good. Now we can go ahead and see how this particular template changed our record. We have the fact that we are recalling this person on a certain date, the fact that they are now hypertensive. We have done their cardiovascular risk assessment within our Q risk tool, and this is how the record will look at the end of it. I hope this was useful, and thank you very much.